yawning, unproductive, fatigue. Does that sound anything like you? And you've wondered, is there a natural way to overcome my fatigue in the workplace? Hello, my successful and healthy earthlings. Mihaela Ragushia, naturopath and founder of the Natural Health Podcast. Today, I'm going to share with you a secret to reducing fatigue, especially in the workplace. We're going to go through and talk about fatigue in the Australian workplace. We're going to talk about the secret of reducing the fatigue and then 3 ways to implement this secret formula. And at the end of this episode, I want to give you an opportunity to join a health and success oriented community by clicking below and joining the Natural Health newsletter. Welcome to the Natural Health Podcast. We bring awareness to sustainable health in the business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. Absolutely love, and appreciate your support. On Mondays, I'm here to provide you with simple, savvy, and sustainable health hacks to optimize your health. In today's episode, I'm going to be talking about all things fatigue, right? I mean, when was the last time, I've got a question for you, right? When was the last time that you felt fatigue? You're probably thinking, well, Mihaela, it's a pretty stupid question because I'm feeling fatigued right now. And you're not the only one. Fatigue is widespread around the whole world and specifically here in Australia. And with everything that's been happening around the world in the last few years, fatigue has just become the norm. It's the way we're feeling. It's the way we're waking up. We're waking up, we've got a headache, we may be exhausted. It's the way we're going through the day. We're doing our work and we just can't concentrate. It's the way we come back home from work where we just go, just give me that beer, just give me that ice cream, just give me that wine, give me anything to calm me. Fatigue is actually a nonspecific symptom associated with chronic health problems and functional deterioration at work. Now, it is a very complex and also a multidimensional aspect. So what I mean by that is because you may feel fatigue and your fatigue may be very different to, let's say, Josh's fatigue next to you. His fatigue and the way he's feeling fatigue is very different to you, but you're feeling fatigue depends on a number of reasons, right? But when we're talking about workplace fatigue in particular, it's a common complaint that requires attention. It requires so much attention, especially right now, because of its high prevalence and association with serious dysfunction amongst workers. If you're an employer and you have employees, I'm guessing, I don't know, correct me if I'm wrong, you want to make the most out of them. You hire them because you want them to do the job properly. You want them to do it the right way. However, if your employees are fatigued, no matter how good of a boss you are, I'm sorry to tell you, but they're probably not going to be achieving the work that they should be at an optimal stage that they should be, or that you hired them at. It's kind of like, well, I hired them 2 years ago, they were on point, and now they're not. Well, let's have a look and think about what happened to these people, right? So essentially, fatigue affects everything, affects physically, mentally. It increases the chance of accidents and musculoskeletal complaints and reduces performance and productivity. The symptom of fatigues are due to individual characteristics as well as other work factors, including physical and mental demands. So if your job is physically and mentally more demanding, the more fatigued you'll be. If you don't have planning involved, work activities, rosters, work shifts, environmental conditions, and even standing for long periods, sitting for long periods, there's so many things that affect fatigue, right? So outside of the workplace, what affects our fatigue? Sedentary behavior. So yes, like what do you do when you're not at work? Probably sit on the couch or just want to doze off and just lay there, right? Lifestyle. What do? You go and open the freezer to look for that ice cream, or you don't exercise as much as you used to. Unhealthy diet. And all of this builds up over time. Fatigue can be mental due to prolonged periods of high cognitive demands along the physical activities imposed by daily load of highly physical jobs. So just because, let's say, for example, your partner works in, this is so, I'm just going to take it so stereotypical, right? So your partner works in construction, physically demanding job. You work in the office in front of a computer. Who is more fatigued? Back in the old days, you would say, well, it's the individual that's working at the construction site. They're so fatigued because they're working a physically demanding job. Yes, maybe that is true. But what about the individual like yourself that's sitting in front of a computer, in front of a laptop, in front of a TV, and that's doing work that's mentally exhausting because you're trying to concentrate on writing the quotes, you're trying to concentrate on using the right words, you're sending emails, you're left, right, center, writing up quotes, you're doing so many things. So when you ask who is more exhausted, who's more fatigued, it depends, right? Just because someone does more physical work does not mean that they are more fatigued. So let's have a look at how it affects, right? So short-term effects of fatigue are reduced attention span, poor decision making, reduced alertness, and poor control of emotions. That's an interesting one. So individuals who are fatigued, and you see this in kids all the time, kids that are tired, they're cranky, they cry, they scream, right? Because they're fatigued. Us adults, yes, sometimes we wish we could cry and just chuck a tantrum, and maybe sometimes we should because it may be beneficial, but we don't do it as much as children. But this is what fatigue can bring on. It can bring on emotional poor control. When you are in a business meeting or when you're trying to make business decisions, you want your emotional control, emotional intelligence to be at its peak. You do not want to hinder that, because when you hinder that, that clearly affects your business performance, right? In addition to that, is also reduced attention span. You can't concentrate on what is happening. You can't do the things that you used to do. Poor decision making, reduced alertness. These are all the things that are absolutely key no matter what your role is, okay? Fatigue also increases the rate of mistakes. How costly? Think about your last business mistake that you made. Were you fatigued? Probably 80% of the time you probably were fatigued, and you can say, you know what, Mihaela, I didn't have a good night's sleep. That's why I made that business decision. This is clearly making a link between if you're fatigued, you're more likely to make a mistake, right? Reduced reaction time. I don't know how important that is maybe in your business, but if you do any sports or anything, reduced reaction time is absolutely essential. Elevated likelihood of accidents and injury. You do not want to have an accident driving to work, driving to your client meeting, driving to a meeting, or an injury at work where you trip and fall, and there goes your time off in a hospital bed, and you can't even look after your family, nor can you look after yourself or your business. These are all the effects that fatigue has here in Australia, but also worldwide. And the thing is these are only short-term effects. Let's have a look at long-term effects. The big ones, right? Heart disease, diabetes, high blood pressure, gastrointestinal disorders, sleep loss, depression, anxiety. And these are just some backed up by research. I can just imagine what you would say if you're fatigued. You're like, wow, I crave so much junk when I'm fatigued. I'm cranky. I yell. I scream. I have a short. I'm irritated. All those things that you may have when you're fatigued, they are all impacting your health and your business. Okay, so now has come a crucial time to adopt measures to evaluate and manage these dysfunctional manifestations of fatigue, because there's come a time that we need to look into it. So now you're thinking, well, Mihaela, what do I do when I'm fatigued? It's exactly what I'm going to go through now. The secret to reducing fatigue. The first word is going to give it away, okay? I'm going to give it away straight away, but here we go. Exercise. Exercise programs have been widely used for fatigue management and also pain relief, and led to improved muscle strength, flexibility, and cardiovascular conditioning, backed up by a study that I found. But not only that, you're probably thinking exercise. Okay, when I'm tired, the last thing that I want to do is exercise. But I'm here to tell you that's the first thing that you should be doing to reduce your fatigue. Let's go and let's dig a little bit deeper about what the research says, right? So exercise has actually been shown to be highly beneficial effects of physical and mental health. It promotes significant changes in your lifestyle and well-being, has a great impact on health of all individuals, reducing mortality rates. So the more you, not the more, I shouldn't say the more, because there is a fine line. If you're exercising, you're reducing your mortality rate, death, right? You want to live longer? Exercise. And increases life expectancy. It also improves your musculoskeletal, blood, heart, immune, nervous system, any system in your body that you want, exercise has been found to be beneficial for it. It can also reduce the risk of other chronic diseases such as hypertension, cholesterol levels, diabetes, reducing your body fat, and so forth, right? So what I'm saying here is there's a lot of evidence for the effectiveness of strength training at the workplace for reducing musculoskeletal complaints in specific regions of the body, but also reducing fatigue. So a variety of strength training protocols are described in the literature, including protocols and so forth, right? This is talking about pain in particular, but fatigue and pain are directly interlinked. I looked into one study, and I want to put this study. This study doesn't have a conclusion. However, bear with me because I'm going to go through it. So the study was done in August 2016. It can be found at the link below. There was 352 workers, both female and male, aged between 18 and 65. They were randomized in either the progressive resistance exercise intervention group or the compensatory work exercise comparative group, right? So the progressive resistance group, they perform resistance exercises that gradually loads in an exercise room at work. And they started off muscle resistance, starting at 30% of 1 rep maximum. All exercises were carried out in 3 sets, 10 repetitions with 30 seconds intervals between, if you want to know a bit more detail about it, right? At the what it was in the workplace. It was a training room equipped with dumbbells, ankle weights, weight plates, and bars. The other group, they performed exercises at their workstation using elastic bands, light workout involving warm-up and stretching exercises, and resistance training of elastic bands in groups at their workstations. All exercises were carried out exactly the same as above in 3 sets, 10 repetitions, 30 seconds intervals. And this was done 3 times a week for only 20 minutes. So the primary outcome measure will be symptoms of physical and mental fatigue and muscular fatigue. That's what they measured, and they assessed it after 4 months. So essentially, they expect with this study, the results of this study will contribute significantly to the decision-making capacity of professionals working in the field of occupational health. So they're saying that this is going to help individuals who work in occupational health to assist your employees, to help with their health, right? They believe that both exercise protocols can be effective for fatigue reduction. However, they are hypnotized that the resistance training one, the PRE intervention protocol, would be more effective. The results haven't come out yet, so I'm going to keep a real close eye on that. But I thought I'll back it up with previous studies that have shown exactly what they hypothesized, right? So resistance training reduces fatigue and improves physical function and quality of life. I'm reading directly from a research paper here, right? So resistance training reduces fatigue and improves physical performance and quality of life in breast cancer survivors. These preliminary results suggest that the progressive resistance training program effectively lowers plasma and tissue-specific inflammation, and that these changes are associated with reduction in fatigue and improved physical and behavioral functions in postmenopausal women. Right. So you're like, I don't have breast cancer, I'm not premenopausal. But imagine what it can do to you, right? Because if this is helping out cancer, individuals who have breast cancer or premenopausal, the changes that it can do to your body are just extraordinary, and it's reducing their fatigue. And you're thinking about it, you're probably like, well, individuals who have cancer, they're probably told not to exercise or they're told to rest. Well, I don't know, is that the answer? Well, from this research, it's maybe not saying that. Let's look into a little bit more, right? The other one is also, it's well established that exercise training induces an increase in muscle mitochondria. I've spoken about mitochondria before. It's an energy, it's a powerhouse. Every cell has it. It's absolutely amazing because it produces energy. The food that we have, it produces energy from the food, right? And it gives us less fatigue, okay? The more mitochondria you have, so essentially the more you exercise, the more mitochondria you make, the more energy you have, right? It results, So it's well established that exercise training induces an increase in muscle mitochondria, resulting in fatigue resistance and enhanced endurance performance. This is for athletes, right? The primary purpose of this study was to determine effectiveness of 8 weeks endurance exercise training on markers of mitochondria biogenesis, which is messenger RNA expression of PGC1 alpha, SIRT1, CS, and mtDNA, for all those individuals who want to know the ins and outs. If you don't worry, it's just essentially saying that it's increasing markers of mitochondria. in specific brain regions, right? This blew my mind, okay? So the brain regions, for any of you who want to know, are the brainstem, the cerebellum, cortex, frontal lobe, hippopotamus, I can't believe hippopotamus, hippocampus, hypothalamus, and the midbrain. And endurance exercise capacity, this isn't done in mice. These findings could lead to the enhancement of athletic performance through reduced fatigue, as well as the expanded use of exercise as a therapeutic option to evaluate the negative effects of aging and treatment or prevention of neurological diseases, which is also fatigue, right? This stuff blows my mind, absolutely blows my mind. So what this is saying is, you may be fatigued in a workplace. So I've got 3 studies there. One still ongoing, specifically to the workplace. 2 other studies saying that when we exercise, we have more mitochondria, we increase our energy, right? And we also reduce our inflammation, one of those studies said. This is mind-blowing. Yes, inflammation does get raised up in short terms of exercises, but essentially long-term, it helps. So what I'm trying to say here is, if you're fatigued and you're worried about your fatigue because it's impacting your workplace, there is an answer, and the answer is exercise. Let's go into 3 tips to implement the secret formula. Number 1, start slow. If you haven't exercised before, specifically resistance training with body weight or weights or resistant bands, if you haven't done that before, start slow, okay? Work with a professional, start slow and get into it. Number 2 is you can use dumbbells. You can use dumbbells, simple, or body weights or resistance bands, as mentioned earlier. So number 1 is start slow. Number 2 is you don't need a gym. You can just use dumbbells, right? Including in number 2 is you can use body weight resistance bands or dumbbells, right? Quite easy. If you have a study or if you have an office or if you have outside, you can put it there and there it goes. And number 3 is routine, right? Routine and structure. So what does that mean, routine and structure? You're like, I don't have time for routine and structure. I don't have time to exercise. Okay, make it your routine. If that is in the morning, before lunch, straight after work, have that resistance band or those dumbbells next to you at your workstation. Makes it so much easier because you see it. You look at it. It's funny because I'm looking at mine right now. You look at it and you go, yes, I should probably be doing that, because it reminds you, okay? So you look at it and you go, yes, I should be doing that. I'm going to do that. So what you do is you put in your calendar, just before lunch, for example, half an hour gym, or half an hour, shouldn't say gym, exercise, half an hour body loving, half an hour physical exercise, okay? Therefore, it becomes a routine. So number 1, start slow, work with a professional. Number 2, have dumbbells, resistance training, or body weights near you. And number 3, make it a routine and in a space around you that you are constantly reminded. So there you have it. If you want to fight fatigue, especially in the workplace, you need to include resistance training, but please talk to a healthcare professional before you include that. See if it is the right thing for you. There you have it. If you have any questions, please feel free to ask me. If you know someone who will benefit from this episode, please share it with them. And like I said, if you want to join a success and health oriented community where we send out newsletters every Friday with bonuses from our guests, with absolutely amazing research like the one I provided with you today, and all other specials, or even sometimes I do, you can win things. Sign up to the newsletter by clicking the link below. And remember, the missing link between failure and success is your health. Content and information provided here is opinion of Mahela Ragoose and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Ragoose does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. Under no circumstances shall the Natural Health Podcast, Mahela Ragoose, any guests or contributors to the Natural Health Podcast, or any employees, associates, or affiliates of Mahela Ragoose be responsible for damages arising from the information provided on the Natural Health Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting a doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mihaela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.